Raghav Chadda, can you explain this seeming mismatch between the claims of your government about the availability of beds and a ground report which shows that patients are struggling and finding it exceedingly difficult to be able to find a bed to get admitted to, given that there have been 16,000 patients of COVID in just the last 24 hours?
I must say that of course that the entire system, the entire medical infrastructure in Delhi and across the country is absolutely overwhelmed. However, the only state in the country to have put out a real-time monitoring of bed availability happens to be Delhi. I am not saying that there cannot be any glitches in the mobile application. There could be. Even last year around the same time you guys had pointed out certain glitches which we had fixed subsequently. However, even now the mobile application shows that roughly 30 to 35% beds are available in Delhi out of the 15,000 total number of hospital beds. I am not even referring to the beds that we have made available in banquet and hotels, but these are beds in which high flow oxygen, BiPAP, ventilator, etc. are available, and 30 to 35% of which are still vacant. However, it takes time for a hospital to update the mobile application, the back end of the app, because the flow of patients is absolutely continuous, and there is a certain time lag which there is a practical difficulty that the hospitals are facing.
Throwing the blame in your direction, Dr. Patra.
See, Rahul, the last thing that in fact the three panelists, apart from the two politicians that you have tonight, would like to hear is throwing of muck at each other. I mean, they are corona warriors, they have been fighting for people, and in fact millions of people who have been affected, who have lost their family members. The last thing that they expect is politicization of this whole thing. Well, yes, India has done good. India still isn't wanting that, because we need to improve the system still better. And as far as all states are concerned, let us be competitive for better. Let's not be competitive in politicization. That, well, yes, Delhi is the only state with the only chief minister who does this and this and this, while Maharashtra and other chief ministers are bad. While Gujarat chief minister is bad, Delhi chief minister shows every morning. Absolutely not required. Because there is a sting operation right now being aired on your channel, and the primary question was on the sting operation, that despite Mr. Kejriwal claiming that there are such many numbers of seats which are vacant and the app is very helpful, we see that, well, yes, the app is not very helpful, it is misleading. Well, yes, my good friend from Aam Aadmi Party may be absolutely right, because there is overwhelming cases, and I understand that the apps might crash also. But to say that other states are not doing good and we are the only ones who have the right of riding the moral high horse is something which the people of this country would not like.
Let me come to you, Dr. Nangia, because I know you are handling a lot of hospital patients at the moment, a lot of them with pulmonary problems as a result of COVID. The big question, Dr. Nangia, at what point should a patient seek hospitalization? Number of viewers are asking this. When do I move in from home quarantine to hospitalization? Is there a particular stage, Dr. Nangia, which you would recommend?
Thank you, Rajdeep, for asking me a very valid question. Actually, people are panicking a lot these days, and even on day one, they want to come and get themselves hospitalized. In fact, we are inundated with calls saying that, doc, I have underlying cardiac disease, underlying diabetes, advanced other problems. So we would like to get hospitalized, or we would like to get our parents hospitalized immediately. But I don't think it really serves any purpose. There is clear-cut guidelines which have been issued by the government which say that hospitalization should only occur if the oxygen levels have started to drop below 94% or 92% in the elders. There's absolutely no point in coming to the hospital earlier than that. And this usually happens in the second phase of the disease and not the first phase. First phase is usually a mild disease where people only have cough, cold, fever, low grade, some kinds of body aches, loose motions, loss of smell, loss of taste. It's only the second phase of the disease, which usually earlier it used to start after the 7th or the 8th day. Now it started to start after the 5th day, when the pneumonia starts to set into the lungs, oxygen starts to drop, patients start to feel breathless. That is the only time when you should come and get hospitalized, or later on if the fever is unrelenting and not settling down. Those are the only situations where you should get hospitalized, or if somebody is vomiting or some other issue, because of which you need IV medication, not otherwise.
Very, very clear. Right. Linked to that, Dr. Nangia, what can a person who needs oxygen do at home? my oxygen is falling, I'm at home quarantine. Is there something I can do immediately at that moment?
Right, so immediately at that moment, probably only oxygen supplementation can help. A high dose of steroids can help. But what is important is that if the oxygen starts to drop, then you should not stay at home. There's a very clear message that I would want to give, that if once the oxygen levels start dropping, then you need to be in the hospital, because we have to give the patient the IV medication in terms of remdesivir, as Dr. Dakkar just explained, along with steroids. Steroids may be higher dosages. Then there are other medicines like tocilizumab that one might want to use in that clinical situation, of course, depending on patient to patient. But yes, once the oxygen levels drop, then there's no reason to stay at home saying that, okay, I've applied oxygen and I'm tiding over the phase, unless, of course, there's a major crisis, if the beds are not available or some other reason why you don't want to shift to the hospital. But otherwise, the oxygen dropping should be the first indication that you need to be in the hospital immediately.
Dr. Parul Sharma, even if 50 people, want to get to the markaz and pray on one floor, in your appreciation, is that avoidable? They may have court permission. In your appreciation, is that avoidable given the current situation?
Absolutely, totally avoidable. Whatever can be done. See, why are we collecting? If business, entertainment, all kind of communication can be done online, even health, even consults are happening online. Everybody is finding innovative ways to stay away from each other, to maintain social distance and to still go about things. Why can't the religious ceremonies or why can't the elections be done online? Use all kind of platforms, social media, digital, this, that, but why gather? Till the time the crisis is not over. It's a highly contagious strain. Have you seen the curve? It's not a curve or a wave anymore. It's a steep ladder.
Oh,
it's a highly contagious one. So whatever can be done, we have to avoid any kind of gathering. Don't put any numbers on it. No numbers, no gathering. Period. Bottom line is stay safe as much as possible. Stay masked. Instead of election wars, instead of gatherings, we need a war footing on COVID management, Gaurav. It's really a grim situation out there.